Important message. If you are waking up in the middle of the night with painful leg cramps or experiencing sudden muscle spasms during the day, you're not alone. Millions in the United States, Canada, the United Kingdom, and Australia suffer from this. But the shocking truth is that many of these muscle cramps can be prevented with the right vitamins, and this could drastically improve your daily life, your sleep quality, and even your mobility. The number one vitamin that often gets overlooked but plays a huge role in preventing leg cramps is magnesium. This mineral is critical for muscle contraction and relaxation. Without enough of it, muscles can go into spasms, causing painful cramps that strike without warning. In the United States, studies show that over 50% of adults don't get enough magnesium from food, especially older adults and people dealing with chronic stress or poor gut health. Magnesium works by blocking calcium uptake into nerve cells, calming overactive muscles. There are several forms of magnesium, but magnesium glycinate and magnesium citrate are the most absorbable and gentle on the stomach. Magnesium oxide is commonly used in over-the-counter supplements, but it has poor absorption and can cause diarrhea. If someone in the United Kingdom is dealing with leg cramps every night and only using magnesium oxide, they might still be deficient because it's just not getting into their system. The body needs magnesium not just for muscles, but also for the production of ATP, which is your cell's energy source. When your muscle cells run low on energy, they go haywire, and that can trigger intense cramping. Some people from the United States report relief within just days of adding a quality magnesium supplement, especially those who were also dealing with muscle twitching or restless legs. Magnesium also competes with calcium, and when calcium dominates without magnesium, muscles stay contracted. That's exactly what a cramp is, a muscle that's locked into contraction. Next is potassium, and this is another mineral that Americans frequently overlook. Potassium is essential for fluid balance, nerve conduction, and proper muscle contractions. When levels drop, like after sweating heavily or taking certain medications like diuretics, your muscles are the first to let you know, with painful spasms. Potassium works closely with sodium, but in the standard American diet, sodium is often sky high while potassium is incredibly low. Potatoes, bananas, spinach, avocado, and coconut water are excellent sources. But even with those foods, many people still don't get the recommended 4,700 mg daily intake. In Canada, many nutritionists say they re-seeing potassium deficiencies more often in younger people who rely on processed food. Potassium doesn't just stop cramps, it also supports heart rhythm and blood pressure. A patient from Australia was experiencing daily leg cramps due to a ketogenic diet and didn't realize the diet was flushing out electrolytes. After adding potassium-rich foods and a supplement under supervision, the cramps stopped in under a week. Low potassium symptoms often appear with fatigue, weakness, and even constipation. All signs the muscles, including smooth muscles, aren't functioning correctly. But cramping is the most visible and painful symptom. Another vitamin that plays a surprisingly important role is vitamin B1, also known as thiamine. This is vital for nerve function and energy production. Without it, the communication between nerves and muscles starts to break down. In the United States, especially in elderly populations and people with alcohol dependency, B1 deficiency is common. Thiamine deficiency is known for causing not just leg cramps, but also tingling, numbness, and burning sensations in the legs and feet. These are symptoms of nerve stress, not just muscle stress. People dealing with diabetes, particularly type 2 diabetes, are often B1 deficient, and Donati realized that their leg cramping could be rooted in nerve damage caused by low thiamine. Thiamine helps convert carbohydrates into usable energy, and without it, the muscles can't properly fuel themselves. This leads to buildup of lactic acid, another trigger for cramps. One man from the United Kingdom shared that after years of unexplained night cramps and multiple failed treatments, his doctor checked his B1 levels, and they were extremely low. After supplementing with benfotiamine, a highly bioavailable form of B1, his symptoms began to disappear. It's emotional to think how many people might be living with this kind of pain simply due to an overlooked vitamin. Then we have vitamin D, and this one is crucial not just for bone health, but also for muscle function. There are thousands of vitamin D receptors in muscle tissue, and deficiency in this vitamin is strongly linked with muscle pain, weakness, and cramps. A study from the United States found that patients with chronic leg cramps often had significantly low levels of vitamin D. Many people in Canada and the northern United States, especially during the winter months, fall dangerously low in vitamin D without even knowing it. Deficiency symptoms can be silent at first: slight fatigue, poor sleep, frequent illness, but then muscle issues start to appear. Older adults are particularly vulnerable because their skin becomes less efficient at producing vitamin D from sun exposure. Vitamin D helps regulate calcium levels in the blood. If calcium is not properly managed, it accumulates in soft tissues, including muscles, leading to stiffness and spasms. One woman from Australia, who avoided sun due to skin concerns, experienced chronic cramping for years and was even prescribed medications for fibromyalgia before a simple blood test revealed severe vitamin D deficiency. Within 3 weeks of high-dose supplementation under medical guidance, her cramps reduced dramatically. This vitamin is not optional. It's foundational. And in the United States, over 40% of adults are estimated to be deficient. The next on the list is vitamin E. While often talked about for skin health, this fat-soluble antioxidant plays a powerful role in muscle oxygenation and blood flow. Vitamin E improves circulation, which means muscles get more oxygen and nutrients. And when blood flow is reduced, like during long periods of inactivity or sitting, cramps become more likely. This is particularly common in older adults in the United States who are on medications that deplete antioxidants or have underlying conditions like peripheral artery disease. Some Canadian and UK doctors now recommend vitamin E for patients suffering from nighttime leg cramps, especially those with poor circulation. One possible mechanism is that vitamin E prevents oxidative damage in the endothelial lining of blood vessels, helping maintain smooth muscle relaxation. A man in his early 60s from the United States shared that after heart surgery, he began experiencing leg cramps so painful they would wake him up multiple times a night. When vitamin E was added to his supplement regimen, the cramps began to lessen and his sleep returned. It is also important to note that synthetic vitamin E, D-alpha-tocopherol, is not the same as natural vitamin E, D-alpha-tocopherol, or mixed tocopherols and tocotrienols. The natural form is far more effective in reducing oxidative stress. Each of these vitamins and minerals interacts with the others. The most severe cramps often come when multiple deficiencies overlap, like a person who is low in both magnesium and potassium, or someone with low vitamin D and thiamine. It's not just about taking one supplement, it's about identifying the root cause. The body sends signals, but we often ignore them until the pain forces us to pay attention. In the United States healthcare system, where people often get brief appointments and minimal lab testing, leg cramps are often dismissed or treated symptomatically with pain medications or muscle relaxers, rather than identifying and correcting the real issue. People end up living with chronic pain when the solution might be as simple as correcting a nutritional gap. Ask yourself, have you been tested for these deficiencies? Have you looked at your diet, your medications, your stress levels, your sun exposure? Even people with healthy diets in Australia or Canada can experience these cramps due to nutrient depletion from modern farming, medication use, gut absorption issues, or high-stress lifestyles. Diuretics, blood pressure medications, statins, metformin, all of these can deplete critical vitamins and minerals. And most people aren't told this when they fill their prescriptions. A young athlete in the United Kingdom experienced frequent calf cramps during training. Despite being fit, his magnesium and potassium were low because of his high sweat rate. He thought it was just part of the game, until his performance started to drop and a nutritionist identified the imbalances. After correcting the issue, not only did the cramps stop, his energy improved dramatically. These examples are not rare. They are happening every day across the United States and other Western countries, and too often they are being dismissed as normal or just part of aging. Another absolutely critical vitamin in preventing leg cramps is vitamin B6, also known as pyridoxine. This vitamin supports the function of both the nervous system and muscle coordination. In the United States, B6 deficiency is often seen in individuals taking long-term medications like birth control pills, anti-seizure medications, or certain antibiotics. These drugs can deplete vitamin B6 levels significantly over time. Without enough B6, neurotransmitters like serotonin and dopamine can't be synthesized properly, and these chemicals help regulate nerve impulses, including those that control muscle contractions. A misfire in the nerve signal can lead to a sudden, painful cramp. In some cases, people in the United Kingdom experiencing leg tingling or muscle spasms were found to have subclinical B6 deficiencies, not enough to be labeled as deficient in a blood test, but low enough to disrupt nerve function. Vitamin B6 also helps in the formation of red blood cells, which are responsible for carrying oxygen to muscle tissues. If your muscles don't get enough oxygen during activity or while at rest, especially during sleep, they may contract involuntarily. A woman in her 40s from Canada experienced daily foot cramps for nearly a year, and it wasn't until she worked with a functional medicine practitioner that they discovered low B6 combined with mild anemia. Once corrected with supplements and dietary changes, the cramps stopped. These kinds of cases are not isolated, especially among women, older adults, and those with autoimmune conditions who already struggle with nutrient absorption. Moving on, calcium is often misunderstood in its role with leg cramps. People hear calcium and automatically think bones, but calcium is just as vital for muscle contractions. Calcium ions are directly involved in triggering a muscle fiber to contract. But it's a very delicate balance. Too little, and your muscles can spasm. Too much without proper regulation can do the same. In the United States, people often overconsume calcium through fortified foods and supplements, but Donna tea have enough magnesium or vitamin K2 to keep it balanced. This leads to calcium being deposited in soft tissues instead of being used properly. That's why some people who take calcium supplements still suffer from muscle cramps. In fact, high-dose calcium without cofactors like magnesium can actually cause cramping. In Australia and Canada, where dairy consumption is high, some individuals think they were getting enough calcium but still face cramps because the calcium isn't being utilized properly. This is often due to low levels of vitamin D, which helps absorb calcium, and vitamin K2, which helps direct calcium to the right places. One elderly man in the United States was taking calcium for osteoporosis, but ended up in the ER twice due to leg cramps that were so intense they caused him to fall. It wasn't until his doctor stopped the calcium supplements and replaced them with magnesium and D3 that the cramps finally stopped. Calcium is important, but without its supporting nutrients, it can do more harm than good. And many doctors don't warn about this balance. The role of vitamin K2 in preventing leg cramps is starting to gain attention, especially in the functional health community in the United States. This vitamin helps shuttle calcium away from arteries and soft tissues and into bones where it belongs. When calcium builds up in muscles or blood vessels, it contributes to stiffness and painful spasms. Vitamin K2 works hand in hand with vitamin D3. D3 increases calcium absorption, and K2 ensures it ends up in the right location. Without enough K2, you may have high calcium in your bloodstream, but still suffer from poor muscle function. In Canada and the United Kingdom, where K2-rich foods like natto, fermented soybeans, are not commonly eaten, deficiency is quite common. K2 is hard to get from diet unless you're eating fermented foods or certain types of cheeses, and most people don't even know it exists. One woman in her early 50s from the United States began taking a D3 supplement during winter, thinking she was doing everything right. But without K2, she started experiencing tight calves and nightly leg cramps. Her blood calcium was slightly elevated, and her physician switched her to a D3-K2 combination formula. Within weeks, the symptoms eased. This shows how one missing vitamin can throw off the entire system, leading to months or even years of unnecessary suffering. Another incredibly important nutrient that is often ignored is sodium, especially in the context of hydration. Sodium is an essential electrolyte, and while high sodium intake is often demonized in the United States for its link to hypertension, the real danger comes from imbalance, either too much or too little. Sodium is necessary for nerve impulse transmission and muscle contraction. During heavy sweating, whether from exercise, heat, or stress, sodium is lost rapidly. And if it's not replaced, muscle cramps can occur very quickly. This is why athletes and even people working manual labor jobs in hot climates, like in parts of Australia or southern United States, frequently deal with cramps. It's not because they re-dehydrated alone, it's because they are losing sodium faster than they re-replacing it. Drinking plain water dilutes the sodium in the blood even further, worsening the issue. A construction worker in Florida reported severe leg cramps despite drinking over a gallon of water daily. It turned out he was dangerously low in sodium. His cramps stopped after adding an electrolyte supplement that contained sodium, potassium, and magnesium. People in Canada and the United Kingdom who switch to very low-sodium diets for blood pressure often don't realize they re-triggering other health problems. Sodium isn't the enemy. It's about context. And if your sodium is too low, your muscles can't contract or relax properly, setting the stage for cramps. Another top vitamin that deserves attention is vitamin B12. This vitamin is essential for proper nerve conduction, and without it, signals between the brain and muscles become erratic. B12 deficiency can mimic many other conditions. It can cause numbness, tingling, burning sensations, and of course, cramping, especially in the legs. In the United States, older adults, vegetarians, vegans, and people with gastrointestinal issues are most at risk. The stomach needs adequate acid and intrinsic factor to absorb B12, and with the widespread use of antacids and proton pump inhibitors, B12 absorption becomes impaired. A middle-aged man from Canada suffered from nightly leg cramps and was misdiagnosed for years with restless leg syndrome. And then there's taurine, which isn't a vitamin but an amino acid, yet it deserves mention here because of its critical role in electrolyte balance and muscle function. Taurine helps regulate calcium flow in and out of muscle cells and stabilizes cell membranes. People with low taurine levels may experience frequent cramps, especially under physical stress or when electrolytes are out of balance. Taurine is found in meat and seafood, which means people on plant-based diets in places like the United States and Australia might have lower intake. It's also used up faster in people with diabetes, heart disease, or chronic stress. A young athlete in the United Kingdom had severe leg cramps despite a perfect diet and hydration routine. Blood work showed low taurine and magnesium. Supplementation of just 1,000 milliliters taurine daily changed everything. No more cramps after intense training. In some studies, taurine supplementation has even helped prevent cramps in people with liver disease or on dialysis, two groups notoriously difficult to treat. That speaks volumes about its power and importance. Many of these vitamins and nutrients don't work in isolation. They are part of a larger system. If even one is missing or out of balance, the entire mechanism can break down.